Please subscribe our channel TMS and also remember to press the bell icon to see more content. Hello viewers, today we will learn about clinical massage therapy in healthcare in Thai massage services video. Please don't forget to subscribe our channel. The practice of massage therapy lay dormant in the Western world from the decline of Rome until the 18th century, when the Enlightenment fostered renewed interest in exploring the frontiers of medical knowledge. In the early 19th century, Pa Henrik Ling developed a system of medical exercises and massage that his followers disseminated throughout the Western world in subsequent years. This system profoundly influenced the birth and development of physical therapy, and the massage elements of his system became what is known today as Swedish massage. This type of massage has been continuously practiced in health clubs and spas over the past century, but it was largely considered a luxury available only to the wealthy, and was not generally viewed as a health-related procedure until the gradual resurgence of massage therapy over the last 30 to 40 years. A young girl has pain that does not go away. Her mother has heard from a friend that there is a healer not far away who can get rid of such pain. One day the mother takes the girl to see this healer. The healer asks a few questions, then, rather than giving her something to swallow, the healer places skilled hands on her and presses and rubs in various places. When the healer is finished, the girl's pain is diminished. The mother pays the healer and they leave. A day or two later, the pain is completely gone. These events may very well have taken place in China in 1000 BCE. They could have occurred in India at least as early as the 3rd century BCE. The healer in question could have been Herodicus or his pupil, Hippocrates, in 5th century BCE Greece, or Asclepiades, who brought the practice to Rome in the 1st century BCE. The story can often be told today, thanks to the rediscovery and development of clinical massage therapy, the use of manual manipulation of the soft tissues to relieve specific complaints of pain and dysfunction. In conjunction with massage therapy, the term bodywork has come into common use. This term arose from two principal sources. First, the psychiatrist Wilhelm Reich, originally a disciple of Freud, postulated the expression of the personality through body structure and formulated an approach to the simultaneous treatment of the body and the emotions. His work has been carried on by Alexander Lowen in a system called bioenergetics. Other practitioners, such as Ron Kurtz, have continued to work along similar lines. Second, Ida Rolf developed a system that she called structural integration, but which has come to be called Rolfing in her honor. Her approach emphasizes the restructuring of the fascia. When we join the terms massage and bodywork, as in the name of the National Certification Board for Therapeutic Massage and Bodywork, we reflect the fact that these two streams are in the process of merging, and many therapists consider themselves the heirs and practitioners of both traditions. Two other approaches to healthcare in the last 2 centuries have also made significant contributions to the formation of clinical massage therapy and bodywork. Osteopathy, see further in the chapter, developed as a medical field that sought to relieve health problems through the manipulation of both joints and soft tissues, and many osteopathic practices have found their way into clinical massage therapy with the help of such osteopaths as Leon Che Ito. In medicine, the late Janet G. Travel, M.D., and David G. Simons, M.D., have explored the phenomenon of referred pain from trigger points, tender points in soft tissue that radiate or refer pain to distant areas. Thus, at a time when many people are looking beyond the traditional medical offerings of pharmacological and surgical intervention, the confluence of these multiple influences has produced the field of clinical massage therapy, which is both one of the oldest and one of the newest health professions. The place of clinical massage therapy in healthcare. The complexity of the human organism has led to the evolution of a variety of approaches to the manual treatment of the soft tissues. Other health disciplines take the following approaches to pain and dysfunction. Traditional Western medicine employs three principal means of treatment: pharmacology, surgery, and referral to an allied therapeutic specialties practitioner. One of the problems with the traditional medical approach to muscular problems is that no medical specialty focuses primarily on muscles. Aside from the primary care physician, family practitioner, pediatrician, internist, gynecologist, etc., a patient with soft tissue pain or dysfunction is likely to see a neurologist or neurosurgeon, specializing in the nervous system, an orthopedist, specializing in bones, or a rheumatologist, specializing in joints. Depending on the particulars of the case, such a patient is most likely to receive surgery, drugs, or a referral to a physical therapist. Osteopathy began as an approach to health that focused on the manipulation of bones and joints, but has since moved in the direction of classical Western medicine. It tends to be heavily represented in certain areas of this country. British osteopathy is significantly different in education and practice from American osteopathy. Certain representatives of osteopathy, such as Leon Ito and Philip Greenman, have maintained the tradition of examining and treating pain problems through joint manipulation, and have had a profound effect on recent developments in clinical massage therapy. Chiropractic focuses on treatment of the joints, particularly those of the vertebrae. These practitioners attribute pain and other health problems to misalignments, subluxations, of the vertebral joints that impinge on nerve roots. Physical therapy uses physical exercise and movement as a means of restoring healthy function to muscles and joints. Although today physical therapists take advantage of many technological advances, such as hydrotherapy, ultrasound, and electrical stimulation of muscles, their emphasis remains on exercise and movement. Also, physical therapists tend to focus on more severe conditions, such as rehabilitation following surgery, serious injury, or congenital deformities. The remaining approach is direct manipulation of the soft tissues. This approach is the special territory of the clinical massage therapist and is the subject of this book. The principles of clinical massage therapy. Clinical massage therapists operate according to certain assumptions that are so self-evident that they might be considered axioms of the field. The individual is a whole organism. Everything is connected and related. Complex systems are more than the mere sum of their parts, that is, it is essential to see the forest and the trees. Although this book is necessarily reductionist to some degree, we cannot understand the whole without knowledge of the parts, and they must be examined in a linear way. The therapist should remember that the part must also be seen in the context of the whole. For example, a client with a sprained ankle will favor the injured leg, causing muscles in the hip and low back to tighten. The resulting imbalance in the back can affect the neck muscles, causing a headache. Treating the neck muscles alone will not solve the problem. Shortened muscle tissue can do no work. Muscle tissue does its work by contracting and, therefore, can do no further work if shortened. What we are concerned with as therapists is persistently or pathologically shortened tissue, in other words, tissue that has shortened, in all likelihood for defensive reasons, is unable to work, and resists lengthening. A muscle may be shortened actively or passively. Examples of chronic passive shortening are the shortening of biceps brachii when the arm is kept in a sling for a period of healing, and the flexed position of the iliopsoas muscles, hip flexors, in a baby who is not yet standing and walking. Postural misalignment always involves habitual passive shortening of many postural muscles. Active shortening, on the other hand, is muscular contraction, and may be either the intentional contraction that is the work of the muscle, or defensive contraction representing the muscle's response to a threat such as overload, repetitive motion, or excessive stretch. When a portion of muscle tissue is contracted in this way, it cannot contract further and is unavailable to do the work of the muscle. The soft tissues of the body respond to touch. One of the most persuasive theories of the many that seek to explain this is that myofascial pain is caused by a self-perpetuating neuromuscular feedback circuit in which the stimulation of touch interferes, thus restoring normal function. Depending on the choice of technique, manual intervention in the dysfunctional tissues interrupts this feedback process, forcing some change in the neural response and, therefore, in the functioning of the affected tissue itself. The intervention may take the form of ischemic compression, passive stretching, passive shortening, or any simultaneous or sequential combination of these. Clinical massage therapy, and therefore this book, is based firmly on these three principles. The clinical massage therapist is one who approaches persistently shortened soft tissues and attempts to restore their natural, pain-free function through touch, while keeping the whole client in mind. Structure and function of muscles. Although we treat muscles as distinct entities for anatomical convenience, we must remember that the neuromuscular system does not activate muscles in that way. The nervous system stimulates portions of contractile tissue to contract in patterns that will produce the desired effect, and this activation usually involves parts of several muscles acting in fine coordination. No action recruits all of a muscle, and no action recruits only one muscle. When we say, for example, that biceps brachii flexes the arm at the elbow, we are making a broad generalization. Depending on the position of the arm when we make the movement, certain portions of biceps brachii will be activated. In addition, portions of brachialis will also contract, as well as portions of certain muscles in the forearm. Portions of triceps brachii will be recruited to temper the movement and keep it smooth. As the movement occurs, a shift in weight occurs, and parts of muscles throughout the torso and legs respond to maintain balance. Therefore, it is not so much individual muscles that do the work of the body as it is patterns of portions of muscle tissue. To gain an understanding of these broad patterns of muscular action over the whole body, we must first acquaint ourselves with the elemental parts of muscle tissue and how they work. The muscle cell. The contractile filaments that perform the work of the muscle are called myofilaments. Two basic types of myofilaments perform the work of the muscle. One type is the thick myosin filament, the other is the thin actin filament. The myosin filament has molecular heads that extend to attractor sites on the adjacent actin filament and bend to bring about contraction. These myosin and actin filaments lie parallel to each other in an overlapping pattern that produces the characteristic striped, striated appearance or skeletal muscle. Several of these myofilaments together form a sarcomere, which is considered the unit of contraction in a muscle cell. If you are visiting Manchester and in need of relaxation, there is no better place to go. All this and competitive prices mean that TMS Traditional Thai Massage just has to be your first choice in Manchester. For more useful tips, please subscribe our Thai Massage Services channel on YouTube.